We are live.
गुड इवनिंग, नमस्कार। ज्ञान प्रवाह की सुगंधित धारा में ज्ञान प्रवाह की सुगंधित धारा में आज फिर हम जुड़े हैं एक नए नज़ारे में। आंखें आंखें जो सिर्फ देखती नहीं, एहसासों का आईना है। ये एहसासों का आईना है, रोशनी की पहचान है और जीवन का सबसे सुंदर वरदान है। तो मैं हूँ डॉक्टर कंचन शर्मा, फॉक्सी की नॉन कम्युनिकेबल डिजीज कमेटी की चेयरपर्सन और आज की इस ज्ञान यात्रा की मेजबान। हमारी फॉक्सी अध्यक्ष डॉक्टर सुनीता तेंदुलवाडकर मैडम की प्रेरणा से हम एक राष्ट्र एक मिशन की ओर बढ़ रहे हैं और आज का विषय इसी दिशा में एक उजली किरण है। 21वीं सदी की चुनौतियां, महिलाओं के लिए दृष्टि समस्याओं पर विजय पाने की राह। हमारे साथ एक ऐसे व्यक्तित्व हैं जिनकी दृष्टि ने देश की आंखों को एक नई रोशनी दी है, जिनका ज्ञान, जिनकी विनम्रता और सेवा भाव सबके लिए एक प्रेरणा है। प्रोफेसर डॉक्टर जीवन एस तित्याल सर, प्रेसिडेंट इलेक्ट ऑल इंडिया ऑफ्थेल्मोलॉजी सोसाइटी। सर, फॉक्सी के परिवार की ओर से आपका हार्दिक स्वागत है, अभिनंदन है। हमें गर्व है कि आप हमारे इस ज्ञान प्रवाह के विशेष एपिसोड, दैट इज 273rd एपिसोड को अपनी उपस्थिति से आलोकित कर रहे हैं। तो आइए आज की इस संध्या को बनाते हैं ज्ञान, अनुभव और दृष्टि की एक ऐसी संगोष्ठी जो कि हर श्रोता के मन में एक उजाला छोड़ जाए। सो थैंक यू सर। Before we begin, I would like to take a moment to acknowledge our dynamic and the visionary Foxy President, Madam Dr. Sunita, a leader par excellence, an accomplished academician, and an inspiring mentor. Dr. Sunita, Madam, has continuously redefined the excellence in the field of reproductive medicine and laparoscopy. Under her visionary leadership, Foxy has launched many meaningful initiatives promoting holistic women's health and many other new projects like Sampurna project, and many publication has been done under her guidance. Her academic contribution and the
Kanchan,
numerous publication.
Kanchan, it is your
Now,
dialogue with
madam,
Dr.
with these words, I just give mic to you for your blessings for this podcast and welcome our guest of today. Thank you,
Thank you.
madam.
Thank you, Kanchan. Can you hear me?
Yes.
Okay. So, first of all, thank you so much, Kanchan, for having such a great faculty with us. Professor Jivanji, thank you so much for coming on a Foxy platform. I'm so glad that you are a president elect and the you know what, she has put up the adjectives with you. Just looking at you also, anyone will see you are a figure of honesty with absolutely academician mind, very kind hearted person. I can say that. I'm not a face reader though, but I can say that this is so easily palpable. Thank you so much for coming on a Foxy platform, sir. Our protocol is you both will have a dialogue and I'll join the viewers link. I joined just to say welcome to you and show the respect that Foxy President joined, because there is such a huge faculty, the dignitary who is joining on this broadcast. So to show our respect, I join you, sir, and thank you so much. But when you are taking over as a president elect, in I have a tremendous interest in regenerative medicine, and I lost my father at his age of 85, and he had a macular degeneration and obviously decrease in his vision. And I think stem cell, there is not only in uh, regeneration and formation of retina, but also the intraocular application for this macular degeneration. I humbly request you, sir, there is a huge need of that in the field of ophthalmology. Otherwise, ophthalmology has grown to a level unimaginable. I did my internship in 1986 and I was first in a ophthalm. And I don't know whether you know Dr. Santosh Adke, a very renowned ophthalmologist from Sholapur now. There was only one seat and he wanted to do, and all the time he used to say, Dr. Sunita, will you not take ophthalm? I said, I will never work only on that, because that time ophthalm was conjunctivitis or it was a cataract, sir. There was no anterior compartment, no posterior compartment, no super speciality. And now the way it has advanced, I think 1995 to 2005, the way ophthalm has taken up, I always watched very closely the growth of this field because I have an interest. I do stem cells for myself, sir, for anti aging, and I take intravenous so it reaches to all organs. I'm 62. I don't have a specs, I don't have a lenses, sir. I don't need it. I don't know whether the stem cells have kept on regenerating, but I have so many patients. I'll talk to you sometimes later, not on this podcast, but I humbly request you, as a president, you find out multicentric research study, and there will be many more. ICMR will definitely help giving you help for the academic grant, ICMR will definitely work with you. So, all the best to you, and all the best to you, Kanchan. The way you speak
Yes.
Hindi and your poetry, it always, always makes me feel so low. My mastery on the Hindi is very poor, and your dialogues are fantastic. Love you. Thank you. And I'll enjoin from a viewer's link.
Yeah,
Thank you.
thank you. And a few words about today's
Kanchan,
subject.
allow me to leave because I
Yes,
have
yes, please.
blocked the security area here. I'm
Sure,
just
sure, sure,
getting that.
sure, Nina.
Thank you.
I'll
Thank you.
just speak a few words about Dr. J.S. Dityal, sir. He has served as the former professor and the chief at Dr. R.P. Center for Ophthalmic Sciences and the Dean, All India Institute of Medical Sciences, New Delhi. He is among the top 2% of the most cited researchers in ophthalmology with over 400 publications in peer-reviewed index journals, 6 books and more than 100 books and chapters and more than 30 orations and the keynote addresses. He has delivered over 2,000 talks, even conducted more than 100 instruction and the courses and performed over 100 live surgeries demonstration at the international and the national platforms. And the most important is that he has been awarded one of the highest civilian honors by the government of India. And that is the Padma Shri for his outstanding contribution in the field of ophthalmology. Wow, sir. Many, many congratulations, sir. And there are so many achievements about him. Professor Tityal has been conferred the International P. Siva Reddy Award as well as the prestigious R.P. Dhanda Award for contributions in eye banking and even keratoplasty by All India Ophthalmology Society and Guru Dronacharya Award even by the Vision 2020 right to sight in India was given to him. He is the president-elect of All India Ophthalmology Society at present and currently he is the president of AIMS Rajkot, Gujarat. With these words, sir, really I am obliged that you have joined this podcast. Now, the floor is yours, and I just have few questions. Sir, you have been a pioneer in advancing ophthalmology care in India. So, what inspired your journey into this field, particularly in eye health and the vision preservation? So that can you tell some inspiring stories so that the youngsters should come more and more in this particular field, because this is a very important field, because this preserves your eyes, and eyes are very uh, precious part of our body.
Uh, Thank you so much, Dr. Kanchan Sharma. And I'd like to express my sincere thanks to the Foxy members and the dynamic president, Dr. Sunita. I think it's a great opportunity and pleasure to interact with a different subject people who also are one of the most important part of society and medical science also.
Sure.
As you rightly said, I have the experience of almost 4 decades in the field of ophthalmology at AIMS New Delhi.
Right.
And a story always begins from the basics. When you are doing undergraduation, you have a feeling that you like to become a surgeon, because
Right.
in our days, if you take a medicine, the only thing which will come in mind is to become a surgeon. And this particular field also gives you a chance to become a surgeon. And it is, people think eye is a very small organ, but it is actually one of the biggest organ for a human being. Gives a sight to a person, life to the person, and the vision to the person also. And any surgery, any correction in eyes, definitely going to improve the quality also. When you actually get into a post graduation in ophthalmology, it gives you so many ideas. It gives you not only the cataract, it gives you a dimension of every layer of eye, right? From the ocular surface, lid to a optic nerve. You can imagine how many dimensions are there. In fact, now we have more than 16 or 17 branches. We call super specialty branches in ophthalmic field also. So you can imagine it's one of the vast area of a very small organ in the eye. And every area is very, very exciting. And I have been trained into a anterior segment surgeries where one of the charm is to do a keratoplasty or grafting, the only grafting which is done in eye, which improves the vision of a person. In fact, one of the most successful graft which can happen in a human body. And it is one of the most exciting field for us. Apart from that, improving the quality of vision by doing various surgeries like cataract, getting your cornea reshaped to take away the glasses burden of young people, and looking into a generation of a people who have, well, in last 40 years, I've seen what changes happen. I think we are the rare people who have been in a 20th century, now in a 21st century. So you can always look into what happened in the 20th century and what going to happen in 21st century. And that is really exciting. So I see the young generation, the generation next is, going to see something beyond what we are thinking or what we actually put into your research mind, and that's going to happen. If you think
Really.
something, it's definitely going to translate for a patient care in the future also. So it is one of the very
Really.
exciting branches.
Yes, really, sir. I am delighted by your such a wonderful answer, sir, because my son is also has taken ophthalmology anterior segment, and he is your student. And by seeing him, initially we were saying that eye is such a small thing. What you study throughout it, but now I have seen, especially eyes are most developing areas of our body, because there are lot many new inventions and new upcoming coming in this small eye. There is, as you told, keratoplasty, even laminar keratoplasty, corneal transplant, and even the lenses, contact lenses changing its shape, etc., are there.
Yes, correct.
Thank you, sir, for giving an inspiring statement for the upcoming younger generation. So, as we mark an era of the rapid change and technology, how do you perceive the evolution of women's eye health in the last few decades?
I think, Dr. Kanchan, this is a very, very important consideration in this, I think, century or for a generation next. because everything depends on how the technology has evolved onto a not only for a diagnostic point of view, the therapeutic point of view, and research point of view. So if
Right.
you look into diagnostics, there has been so many incorporation of modern devices. Like, we never thought we could see the retina, without having a histopathology of retina. Now we have a OCT, ocular coherence tomographies, which can be a section of eye from the cornea to optic nerve, layer by layer. In fact, now we have a diagnostic equipment which can give you the cellular level dimension of retina also. So things have changed in every area, and I could never imagine when I joined PG in ophthalmology that cornea would be in multiple layers. We could take out each layer and replace each layer of a diseased cornea, and we should just do sacrifice the entire cornea for any corneal disorder in keratoplasty. So it's become a customized treatment for every disorder in the eye, and that also translates into everybody. Let it be a patient or let it be a physician. Both are part of a technology improvement or technology advancement in these fields. As far as women are concerned, and they are also part of advancing technology. But with this technology, there are incorporation of various disorders also. The modern gadgets which we are used to now, especially the digital media which you are
Right.
have to be in for a more than hours and hours. That's going to take your eyes in a different manner. You can have eye stains which you call asthenopia, which gives you a headache, ocular pains,
Right.
dry eyes, which has become so common in modern generation work style, lifestyle disease.
Right.
People have a sedentary life because technology takes away everything. So you can have disease like diabetes, hypertension, so many other issues can come up, and women are not spared with these disorders also. So I
Right.
could say technology is for making things easy, but it also puts you so much of stress in your body also, because we are left without doing so many physical activities.
Right, right. Yes, so according to you, that although there is a lot much of advancement in the technology, so it is beneficial in a way that there is new diagnostic techniques like OCT, different sections of the eyes can be seen. Even this small cornea, this has too many layers and can be done repair work in the layers, that is the laminar keratoplasty. But this technology like digital advancement, like seeing looking more into the computer working for long time, even the mobile works etc can increase the diseases and even the lifestyle like sitting long with these gadgets can increase the other diseases like diabetes, metabolic diseases, all the lifestyle diseases. So they may have effect on our eyes. Thank you, sir, for enlightening us. What are the most common vision problems you see in the women today, and how do they differ from the men's in the visual health challenges? How there is a woman's problem differ from the men?
I think, most problems associated with vision or things which are associated with your eyes are not grossly different in a men and women. But
Right.
there are certain disorders which are more common in a woman, especially like, if I look into age-wise, because most age-related disorder come after 40 years of age. The one of the common disorder which affects more commonly with the females are glaucoma. In that also angle closure glaucoma, because the configuration of eye is little different from a men to women. So this
Right.
this can be segregated like angle closure glaucoma are common in females over 40 years of age. And
Right.
second group of disease could be related to a hormonal change which happens at the time of menopause, and that can be menopause related dry eyes, the difficulty in maintaining the autoimmune disorders which can get accentuated, thyroid disorders. More commonly, at this age, people will suffer from the arthritic disorders like rheumatoid arthritis, and other problem like SLE is more common in the females. And other thing which are can be linked into the in our society wise. Suppose we have a cataract in our society, we see more advanced cataract in the ladies or females, because maybe they don't come out for an early intervention. Similarly, people suffering with the diabetes, hypertension, other systemic disorder, they come slightly later in a presentation, and the management becomes little difficult and challenging than the people, the men who have been more proactive in coming for a medical treatment. But there's a one large group of young ladies. I say ladies because they become after 18 or 19, so 19 years of age, when they finish their schools and the graduation, and the large chunk of people go through the procedure called refractive surgery, where we take out the glasses burden to them by doing laser procedures, and this number is also increasing day by day,
Mm.
and it also has its own implications in future also. Getting the advantage of refractive surgery also has few problems or dry eyes or other issues coming with these young ladies also. So if I see the dimension of a disorder, they're almost similar, but certain disorders are little common in females.
Right. So, as you have enlightened us that things are more common in the female, like angle closure, glaucoma, and because of the certain autoimmune diseases, many things in the eye are more common. And the other thing I can understand that because of now correction of the vision in the new upcoming generation which are coming to you, that they are coming for the contact lenses and for the good looking facial experience, expression, etc. There are more incidents of the dry eye, as you are
Absolutely
saying.
correct. Yeah.
And the other thing is the hormonal changes. As menopause comes nearer, there are changes in the hormone and they affect our eyes of the ladies. And the third thing is that the ladies, they are less coming for the checkup, because still in our society the ladies are, although many ladies are coming outside of the home and doing the work equal to the male, but even then there are more incidents that even in the middle class and the lower classes, many ladies, they are working at home and they are not coming to doctors for their checkup and coming late, so their diagnostic problem is there. The other thing is that the ladies, they get pregnant. Sir, so what are the factors? What do you advise them during the pregnancy? Before conceiving, do you advise any ophthalmic checkup, or during the pregnancy, or and the afterwards? What are your suggestions to these type of the ladies who want to conceive and who are conceiving? Does any non-communicable diseases like diabetes, etc., they affect their eyes, and how does they affect?
I think Dr. Kanchan, this is a very, very, good question for this forum, because we know that there will be a lot of changes in the body, a lot of physiological changes, hormonal changes when no lady perceives, and when the gestational age advances from the first to third trimester. So if some ladies are suffering from diabetes, hypertension, they must have the checkup before they plan for babies from themselves. So primary checkup should be before they conceive. But even if they don't have any problem, they should have a baseline checkup done, especially for a few things. One is your visual acuity should be checked. If you are wearing glasses, check your number of glasses. Look for a change in the intraocular pressure. It must be recorded. And most importantly, the fundus retina examination should be done at least once before you plan. And if you proceed, then in the first trimester, one checkup, second trimester, second checkup, and third trimester, third checkup routinely should be done. This is a standard procedure should be followed for
Important.
all these ladies who have become pregnant. But
Very
those people who have diabetes, hypertension, they should have be more careful. especially if there is a induced, diabetes and hypertension, pregnancy induced, they require a definite checkup with the ophthalmologist. People who have undergone refractive procedure beforehand, many young ladies would have undergone refractive procedure because their procedure effect can change after the pregnancy. So they also require a regular checkup in these cases also. So this is a very important point because sometimes we can pick up the changes happening inside the eye. So it can be hypertensive retinopathy, it can be diabetic retinopathy, and that can be, treated. You can treat the hypertension, you can manage the diabetes, and just wait for a pregnancy to be over. But good thing is most of these pregnancy-induced disorder will, recover after the pregnancy is over in next 3 to 6 months. Rarely people continue to remain diabetic in such situations. So, but yes, it very very important to have checkup done. But if you have pregnancy-induced hypertension, especially eclampsia cases, then examination is very very important in these cases.
Right.
Yeah.
Sir, so according to you, this is very important and new concept. I think all the Foxians who are watching this podcast should know that ophthalmic checkup is very important and essential for all the ladies who are planning to conceive and who have conceived. As according to you, they should get one eye checkup and the fundus examination before they conceive and one in each trimester, as I understand with your talk, sir.
Uh,
And
Dr. Kanchan, let me add one thing here also.
yes,
Any
sir.
prescription, which may be given by us or given by the physician should also be, should also be considered what are the side effects of these, medication, a systemic or a topical medication to the baby also. That should be
Right,
carefully adjust. And when you are actually doing the examination of the baby with ultrasound, especially
right,
first and second trimester, you should also look for not only the deformity of other parts, but deformity of eye should also be looked into in entirety.
right.
Sometimes, that can be a pinpointing the gross disorder which baby may be going, and termination of pregnancy can be considered at that time in a right time also. So
Of course,
when you are
sir.
doing ultrasound, eyes should also be looked into because the eyes develop within the first trimester.
Of course, sir. As now, this is in our protocol that we are doing anomaly scan from 18 to 20 weeks. And
Yes.
in anomaly scan, they scan each and every part, even eyes, even kidneys, even brain in a detail. And they give us a detailed report. So they should be focused on eyes also, that because any problem in baby's eye can be diagnosed at this very stage. What are the diseases which can be diagnosed by the ultrasound when the baby is in utero? Please give a light on that.
No, especially, as far eyes are concerned, sometimes, you may have the anophthalma, that means eye is not forming at all. The both eyes may be so small to detect also. Sometimes they can be, associated, we can say enlargement of eye inside the, womb only, which indicate that there is some abnormal growth happening in these cases. Or a partially deformed, eyes can be picked up because this can be a part of the syndrome the baby may be suffering, and especially the incomplete formation or no formation of eyes. Both can be there. We call anophthalmos, where no eyes are there, or they can be microphthalmos when the very very small eyes are there. And those are normally associated with the systemic disorders also, like cardiovascular deformities. So this can point towards the some sort of syndromic deformity in these cases.
Right. So looking at eye, even at the time of ultrasound, as we do in anomaly scan, we can pick up many other syndromes, systemic syndromes like anophthalmos, as you said, or microophthalmos. We
Yes.
can pick up many systemic syndrome. Sir, I have heard from you that if the baby delivers before the time, that is the premature delivery, what are the precautions? Are there any risk for the eyes of the baby? What are the precautions which are to be taken, and what do you suggest for these type of the babies, infants, neonates?
Yeah, I think that's a very good point you have raised, Dr. Kanchan. I
Yes.
think, any premature baby, that is one, very important aspect to look into. Not only you're looking for a respiratory problems, you should look for eyes also, because eyes can get retinopathy, which we call retinopathy of prematurity. So
Right.
one is a gestational age less than 32 weeks. So
Right.
every baby should be examined properly within the first 1 or 2 weeks. But even a baby birth weight is less than 1,500, 1.5 kg.
Right.
The child, baby may be 37, 38 weeks. But if the birth weight is less than, no, 1.5 kg, that is also can be a high risk for a developing retinopathy of prematurity, or we call
Okay.
commonly called ROP disease.
ROP.
Because this ROP damages the retina formation properly, and totally retina can be totally detached, and child can go blind within a month. So this
Oh.
has the huge implication of early examination by the trained ophthalmologist of the
Oh.
retina of a child, of the infant, and if needed, the treatment has to be done as soon as possible within the first 2 to 3 weeks. And no babies can be discharged without the proper ophthalmic examination once the premature baby is inside the neonatal ICU. So that is a recommendation by the government now. As I said, less than 32 weeks or less than 1.5 kg birth weight, or child who had the difficulty in breathing and also admitted in a neonatal ICU where oxygen has been given. So these are a important risk factor. Apart from that, if child also has septicemia, so these can increase the chances of retinopathy of prematurity. The coordination between the obstetrician, the pediatrician, that is called neonatalist, and ophthalmologist, these three are a triad to save the child's vision, and it is their of legal duty to examine and treat the premature babies now.
Oh, thank you very much for giving us very important point. Now I can understand, and I just want to give a message to all the watching 46,000 Foxians that each and every gynecologist obstetrician should be very conscious about when the baby is premature, either less than 32 weeks or less than 1500 gram when born in this particular dimensions, then usually within 2 3 days or 2 3 weeks eyes should be checked up by ophthalmologist. So there should be a good um, uh, tuning between the ophthalmologist, between the gynecologist, and between the pediatricians, so that the disease of the retina can be diagnosed at the very earliest point. Sir, when we diagnose, can we have any treatment of VEGF injection or
Yes,
any
yes.
laser or any other operation, so that can we prevent the retinal detachment or prevention of the blindness of the neonate? So please give a light on this.
That's a good point, because actually when the baby is born premature, the retinal vessels have not regressed. Normally, it regresses before within the 32 weeks, but
Right.
the regression doesn't happen. In fact, there's a new vessels growing in the retina which causes damage to retina. So we have to prevent this new vessel growth in these premature babies, with ROP babies. We can inject, anti-VEGF, that is anti-vascular growth factor injection inside the eye, that can prevent the, further growth of the new vessels, and retina will remain attached. If needed, multiple injection has to be given in these babies. Sometimes the lasers may also be required. So these are the treatment for a initial, if you pick up in an early stage, stage 1 and 2. But if you delay the diagnosis when the stage 3, 4 comes, where the entire retina has got detached, then you have no option. You have to do a very extensive surgery, the vitreoretina surgery in these small babies, which is also difficult, and the prognosis become very, very poor if you have to do a surgery. But there are situations where you don't have chance to do surgery also, because the entire retina would have been totally crumpled. Therefore, the importance of early diagnosis in these cases also. In Indian scenario, like what I said, 1,500 gram weight, but in Indian scenario, even a 2,000 gram baby can also have a ROP. So that is should be looked to, especially those babies who have septicemia or they have been less than 32, 34 weeks. So you have to be very, very careful. In fact, all babies who are born, their eye examination should be done before they are discharged, not only the premature babies.
So
In fact,
very
that's the
right.
first examination of the baby born in this world.
Right. So this again shows that there should be an association between the ophthalmologist and the obstetricians and even the pediatricians for the well-being of the baby, fetus, and in other words, for the nation, because eyes are very important for the well-being of each and every person. Thank you very much, sir. As we know, like the diseases, because I am the chairperson of Non-Communicable Disease Committee, Foxy. So I am more concerned about these non-communicable disease whose incidents are now increasing, and our government is also taking a lot much of step towards curing these non-communicable diseases. As there is an increase in incidence of these non-communicable diseases like diabetes, like hypertension, and the thyroid disorder, etc. And these all affect the vision. So how do these need specifically, what are the impact on the eyes in your words?
I think, Dr. Kanchan, you rightly pointed out in India, the one of the largest contributory factor for a blindness is these, lifestyle related disorders now in 21st century. Because these are a major challenge because we have seen that our life expectancy has increased. So if you live longer, you're going to have these, disorders, especially the diabetes related problems. We know that India is a capital, diabetic capital. Every, 6% or 7% is maybe suffering from diabetes.
Right.
And amongst the diabetic patients, almost 70 to 20% people may have a diabetic retinopathy. And of that, around 4 to 7% may have the blinding diabetic retinopathy. So we don't want people to reach up to blinding stage. Therefore, early detection of any diabetic changes in the retina should be picked up so that we can prevent blindness happening in these cases. This I say because the incidence of diabetes may be equal in the both males and females, maybe slightly less in females, but the incidence of retinopathy is almost equal. And the detection of retinopathy is slightly later in women because they don't come out for examination. Therefore, they have more chances of a blinding disorder. They can have a sudden hemorrhage inside the eye. They can have a sudden, loss of vision because there is a massive macular edema, and they don't come out for treatment. Therefore, they lose vision. So that is one important factor. Hypertension also is more common with the ladies also. Again, uncontrolled hypertension, which can cause, we call, they have a high risk of a brain stroke. Similarly, they can also have term can be coined as a eye stroke, where the vessels of eye can also get blocked
Oh,
and that area of retina can get totally infarcted. So that type of thing happen with the uncontrolled hypertension, and whenever you have a lipid profile is dearranged in these cases also. But commonly as older age, the macular degeneration, which you call age-related macular degeneration or ARMD, that can be a really challenge in managing because there are hardly any cure. The only thing is we can prevent the blinding disorder happening in these cases. So
right.
if you have a dry ARMD where no vascular growth is there, then you have a chance for having vision for longer time. But sometimes we have a wet ARMD where a lot of vessels grow, new vessels, which you call neovascular growth, or there's a lot of swelling in the retina.
Correct.
Then these people can have a loss in vision if not treated at the right time. In fact, these anti-VEGF injections are treatment for these cases with macular edema in diabetic patients or a neovascular ARMD also, and they can give the vision back to these people suffering
Oh,
from these. Apart from that, in women, thyroid disorders are more common because
right.
that can be really challenging sometimes. the thyroid ophthalmopathy, and that
Right.
is not actually related to the condition of a thyroid. Even people suffering by thyroid toxicosis or a hypo, or a euthyroid, in all situations you can have a ophthalmic features also. Therefore, the inflammatory ophthalmopathy with thyroid should be controlled appropriately. So these are common disorder which are non-communicable disorders. But of that, the most important lifestyle disease is dry eyes, which
Right.
is so common in every age group, more common in the older age group of ladies also. So that is a huge burden to our society, treating these people because they suffer chronically, and the drugs and drops and has to continue lifelong. Like
Right.
if patient suffering from glaucoma, then the drop has to continue lifelong.
Right.
And this is very important for all of us to understand. Glaucoma can be a totally blinding disorder without any symptoms. Sometimes people come to us when they're already getting, blindness, because that can be only way they realize they're losing their vision. By the time it's too late. So therefore, early pickup has to be done by good diagnostic investigations, so that we can prevent the damage happening in these group of patients also.
So very nicely explained that our eyes are a window, and that can tell even many times our systemic diseases. Like by seeing on the eyes, you have told us that we can many times these type of the patients go first to the ophthalmologist complaining some ophthalmic problem, and then when you see do the fundoscopy and see the eyes, you can just refer those patients to the physician that they have diabetes, they have hypertension, or vice versa. So,
Yes,
eyes are a window of
absolutely
our
correct. Yeah.
health, according to you.
And
And
Dr. Kanchan, sorry to interrupt you, but I can just add one line here. We know that communicable diseases are also prevalent in India. And
right,
sometimes we pick up these, diagnosis by examining the eye only, like
right,
people suffering from a tuberculosis.
right.
So they don't know they are suffering from tuberculosis. They suddenly come with the ophthalmologist for a decreased vision. That means they can have a tuberculous uveitis or tuberculous retinitis. So we can pick up this, communicable disease of tuberculosis by only eye examination. They
Great,
have
great.
inflammatory nodules in the iris. The classical leprosy, tuberculosis, sarcoidosis,
Oh,
patients suffering from immune deficiency diseases like AIDS. So those things can be picked up by examination of eyes only. So it's not only the
non-communicable but
non-communicable, the
communicable
communicable
diseases
disease
also,
can also be
like
picked up.
tuberculosis, sarcoidosis,
Yeah,
AIDS even, and that can be diagnosed first by the ophthalmologist and
correct.
then can differ. It's a great knowledge for us, and it's a great to know, sir, that by looking only window of our body, that is the eyes, you can just have idea of many diseases.
Absolutely.
It's great to know. And one question about the dry eye, as we were discussing about. More of the computer and digital world, and more the work on the computer, the people are working from home or computer even throughout the night, and even we see many computer persons they are doing now, the computer engineers are there. What are your advice? Is there any rule of 2020 which you just were telling to us, that what are your advice, and what are the why these dry eye conditions are increasing nowadays? Your views.
I think you rightly pointed out dry eyes is the new I can say fashion of this computer vision related
Right,
problems, which we earlier called computer vision syndrome. So
right,
nowadays it has become a lifestyle disorder,
right,
and every person can suffer from dry eyes, right from the childhood to adulthood also. If
right.
I segregate the various, important, you can say, risk factors, in
Mm.
children, it is allergies, because
Oh,
that can suddenly As time passes, they can have a dry eye because these allergies damage the, all these ocular surface, the glands, and
Right.
they suffer from a severe dry eye subsequently.
Right.
As you grow older, if you have undergone laser surgeries for your eyes, you would have more dry eyes.
Right.
And if you grow older, you assess have your glands getting little more degenerated. They secrete lesser lacrimal fluid, and
Right.
the systemic disorder can also compound your dry eye conditions. But actually, the major problem for us is the environmental factor, where we are living with the lot of pollution in the atmosphere, which hits your ocular surface,
Right.
changes your tear film quality. The tear film maintenance become very very poor, and that leads into your lid margin deformities, which you call MGD, or a Meibomian gland dysfunction.
Right.
And from that, aqueous secretion can also decrease from lacrimal glands. So all these are a compounding factor of environment, and this gets accentuated by looking into a screen for a long time. When
Right.
you're actually looking at the screen, reading in the screen, working in the screen, you don't blink that often. Normally, you should be
Right.
blinking, at least 10 to 15 times in a minute.
Oh.
So once
Oh.
you don't blink, your tear film is getting dry, and
Right.
that induces the, pain, redness, irritation, foreign body sensation, not seeing properly. If
Right.
that becomes a, norm for every day, you're going to have a chronic dry eye. So once you have a chronic dry eye, there's no reversal because you already damage your ocular surface.
Right.
That's why you rightly pointed out 2020 rule,
Oh.
which we made during the COVID time because everything had become a work from home, and
Oh.
people are suffering because of these, a strain in the eyes and dry eyes also. So this 2020 rule was, if you're working for 20 minutes, break for a 20 seconds, look outside, far distance. If you can see the greenery, that will be better. Blink at least 15 to 20 times and go around and come back and start again. The idea was to break the cycle of a dryness so that you don't have a long stretch of dryness in your ocular
So
surface.
work for 20 minutes, uh, give rest for 20 seconds, and blink for 20
20
times.
minutes, 20 times, yes.
20
Now,
times. That is 20, 20, 20.
recently I have another 20 seconds in a people, like we are sitting in a computer now, because your neck becomes very rigid because you are fixed. So I say for 20 seconds you do a neck exercise also. Do no stretch like this and go sideways movement. Put
Yes.
your hand and stretch your muscles. That also is very relaxing. So this breaks the your monotonous damage to not only the eyes, the entire body also. So these type of break in between can be customized to about your work. Sometimes you can't break within a 20 minutes. So if you're working for a 1 hour also doesn't matter. But after 1 hour you break for at least 10 minutes. So in those 10 minutes you do some other activities, talk to somebody. If you have a severe dry eye, put lubricating drops at that time so that your surface, the ocular surface become normal and they are wet and you feel better also. So these dry eyes can be diagnosed by person him or herself because they have the symptoms. They can have a blurry vision, they have a itching, pain around the eyes, swelling around the eyes. They know that it's because of dry eye. So it is up to you to manage yourself because we can only prescribe the medicines, but customizing your work is a very very important in managing dry eyes. But the other important thing we discussed was systemic disorders,
Right.
the autoimmune disorder, like people suffering from a rheumatoid arthritis or
Yes.
spondylitis, or if they have some chronic disease like a lung disease, or if they have some skin problem like a dermatitis,
Yes.
SLE. So they all have a autoimmune dry eye. There you require treating the eyes with the not only the lubricating drops, you have to manage with the immunomodulators also. Now you can start with a steroid sometime, you can shift to a methotrexate. So those are different lines of treatment for or patients. So many patient would be with the gynecologist or other people. So they can also think of sending these patients for examination, and we can improve their condition both systemically and locally also.
So, very right. Starting from the environmental pollution, environmental allergens,
Yes, yes.
to different autoimmune diseases and screen exposure. Everything is very nicely explained by you, sir. I think all the Foxians should take a lesson from all of this. What are the blue light exposure and the digital uh, strain real threats?
I think this is the new concept. Like blue lights are not good for eyes, and it is true also because blue lights they reach up to the retina, and if they are chronically exposed to blue light condition, your retina can damage, which we talked about macular degeneration. So these degeneration can be more compounded by these blue lights, but actually blue lights can be prevented by our natural process. The cornea, the lens which is inside, they slowly, especially the crystalline lens becomes little, yellowish as the age advances, and that is supposed to block the blue light reaching the retina also. But if you're looking at a screen nowadays, you have a more exposure also. We all have LED lights across the streets. Your home lights can also be LED lights, and they normally emit blue light wavelength.
Right.
So those can be, in the long run can be damaging. But a short exposure doesn't make a huge difference. But if possible, if you can afford, you can have spectacles with the blue filter lenses. So that can be, preventing, especially it is useful for dry eye cases also. And we have found that people have done research in children also. Maybe one way to prevent progression of myopia in the children also. So it has a huge impact in a lifestyle, blue light here.
So, do you advise some yellowish light, yellowish ditch light for these
Normal,
very cases?
yellow lights are better for
Better.
eyes than the LED
Right.
lights. LED lights are more brighter and they are long lasting also. But in fact, they are quite harmful to eyes, especially those people who are suffering from dry eyes, who suffer from the undergone cataract surgeries, or person who has the retinal problems, or some group of patient where they undergone laser refractive surgeries also. Nowadays, you would have heard, laser treatment to cornea. Sometimes we do a treatment for a keratoconus. We call cross-linking of a keratoconus cases. There also, blue light is a a high risk factor for deformity in these tissues also.
Okay, okay, very nicely explained, sir. I have a question because now the ladies they are very um, beauty conscious. Many
Yeah.
ladies are very beauty conscious. They are taking always the steam. They apply massages, do the facial massages, and taking the steam with the open eyes. Does it have any damaging effect on their eyes? The steam with the open eyes. That is just my question, whether the heat or the steam that damages their eyes or lens or anterior chamber or some or cornea.
Okay, the steam, can damage your ocular surface. If your eyes open for a long time, the steam is directly hitting your cornea and conjunctiva. Your tear gets, evaporative because of heat. Though they say there's a moisture, but this moisture doesn't work because this heat is much more in these, places, and directly impacts your corneal epithelium also. Other important would be, many people have a habit, they splash water in open eyes. Even
Right.
that is not recommended because if you have some sort of defect in your corneal epithelium, or your eye has some sort of inflammation, that this forceful water splashing can also damage your eyes. And nowadays, the water supply we have cannot be, uh, guaranteed that they are safe because they can carry germs. They can have the different pH value. Sometimes they are acidic, sometimes they are alkaline. So these things are little, challenging. Better would be, close your eyes, then splash water. The cool effect will be there. If you have some irritation in the eye, you can always use, safe medication, which we call, artificial tears, that you can put it and that will clean the eye from inside. So that will be safer. But classically looking for a heat induced damage can also be there, so you should be little careful how long you are getting exposed. Better would be close eyes at that time also. And
Very.
for other areas like putting lot of makeups, so that can also be challenging, especially young ladies who are using contact lenses. So when you're putting makeups after you put a contact lens, you should be little careful not overdoing the makeup, because these particles can get inside and they can, irritate your eyes also. So whenever you are using contact lenses, first put your contact lens, then apply your makeup. Similarly, when you have to take out a contact lens, first remove your makeup, then take out the contact lens. So that's a small tip for our contact lens users.
Very important point. Especially the ladies now are using more of the contact lens because
Yes.
of the beauty consciousness. So you have advised very important tips that first apply the contact lens, then do the makeup, and first remove the makeup, then apply the contact lens.
Then take out the
So,
contact lens.
yeah.
Yeah.
So, sir, what are your simple and daily eye care habits which a woman can adopt at home? What are your suggestions just to improve and have a eye care?
I think there are few tips I can give the ladies at home, homemakers, or those ladies who are working also. Whenever you're coming from a workplace, the first thing should be, you wash your hands thoroughly with the running water. Use a, detergent or soap to clean your hand, then wash your face. And that will take away all the, dust, the particles from your hand and from your, face also. And your eyes will get clean. So that's whenever you have to, do something, clean your hands, especially when you're working also. Your computers, your iPads, your mobile phones, they carry a lot of germs. So don't, rub your eyes with your hands more often, because rubbing eyes never desirable. Most of the complication happens because of rubbing your eyes. Many people rub their eyes very, very vigorously, which is not desirable. The other important thing, people working in the kitchen or some other areas, because sometimes when you are actually working in a kitchen with you can have things getting from the fumes, or sometimes the oil which is being boiled can uh, uh, burst into your face also. So if you are wearing spectacles, you should wear spectacles, because that can protect your eyes also. If needed, you should know the proper distance. You never, bend onto the, cooking areas, but do work from little away in these cases. Keep your, things little away from children, especially spices, or, those, cleaners which you use for, you're cleaning your, you can, utensils, or cleaning your, washroom areas. Those are, acids, and if they can be, damaging to your, kids sometimes, they should be kept in a proper place, and make sure you don't get injured, because old age is very challenging for all of us, especially for ladies. They always have, the bones are little weaker. They have less vitamin D's and less calcium levels. The bathrooms should be safer. You keep, things in the bathroom where you don't slip. So these are small precautions should be taken. Eyes wise, whenever you work, you have to use glasses, because if you require a near glasses, use near glasses for near work. Otherwise, if you're seeing the television, which is a very common practice of people at home, always use corrective glasses to so they can see clearly what is happening in a television. If you can't see the subtitles in the television, that will be the indication that you require a checkup from an ophthalmologist.
Very important tips, sir. I just question like that. Do you advise sunglasses while going in the sun to each and every person? They should use it.
I think, sunglasses are not fashion. They are, important, accessories for our eyes also.
Right.
And the correct sunglasses should be used, because sometimes people pick up, these, shades from the, in the roadside also. But they,
Yes.
they may not be a good idea, because these lenses may not be actually the proper lenses. And in
Right.
fact, they can harm your eyes also. So
Right.
always go to proper, optical shop and pick up the proper shades also. And most important function of sunglasses are you protect you from the UV rays. And it depends, if you are going to, seaside, there is a more of ultraviolet A rays coming in those areas. So you have to have a sunglasses which can block the UVA so that your eye does not get damaged. So those are very, very important things also. Some people use shades for a night vision also. For that also, you have to pick up a right, lenses, which can, give you a prominent or improved night vision also. So sunglasses have a different qualities and different shades, and it depends which type of rays you want to block. And classically, if you're going to a high altitude or if you're going to seaside, the UVA rays should be blocked so that you don't get damage to your eyes, especially cornea and retina in these cases also. Otherwise, if you have undergone surgery, like it's so common if you see cataract patients, they use a dark goggles. The dark goggles are basically preventing more light entering your eyes and also preventing physical touching to your eyes also. And these people who have undergone cataract surgery, normally they feel they should be using dark glasses throughout their life. It's not necessary because nowadays the intraocular lenses we implant after the cataract surgery, they are all UV filtered lenses. So you're pretty safe there. You are not going to have a retinal damage after cataract surgery.
Very, very important message, sir. Um, uh, just because the time is coming near to end, sir, just because you have inspired the generation of ophthalmologists, and now you are coming as a president of All India Society of Ophthalmologists. So when you will be as a president, what is how can organization like Foxy and AIOS they should collaborate to raise the awareness about the women's eye health?
I think that's a very important issue you have raised, Dr. Kanchan. I'm thankful to your Foxy that we have this uh, podcast, which also gives me a lot of thinking for how to get association with such a large organization. You have more than 40,000 members of your society. We are around 30,000 members in our society. And the few things which we are looking for a next you can say 10-year plan and 20-year plan which we are making is basically looking for a few areas. One is improving the AI based diagnostics for a common disorders which can be preventable, especially lifestyle disorders which we talked about: diabetes, hypertension, diagnosis of cataract, glaucoma. All these can be done. But if you look into people of gynecology or obstetrician, so we are looking for a one. We discussed the pregnancy related problems which we can all combine. What are the various things which we can do to collaborate? Not only the ultrasound or examination of eyes, we can look for detection of various, you can say, syndromic thing happening in the womb of a baby, womb of the baby. There we can do a tear analysis and see what changes happening in these cases also, and we can match with the blood analysis also. Some genetic studies can be done, especially in a family history of various hereditary disorders, so we can pick up early in these cases also. But I see the association can be looking for a better health of women, especially presbyopic age, where the proper corrective glasses has to be given. Early identification of glaucoma, which is I think very very important for a female age group, and the post-menopausal. I think the hormonal changes which is happening is the major factor for all these non-communicable disease being more prominent in ladies. There we can have a definite association to look into what hormonal changes are happening and which part of eye, which part of the body, where which tissue level we are having problems, that can be assessed, and we can have a collaborative research in these area also.
Very good. So, looking forward, with the great association between the ophthalmologist and the obstetrician Foxy and the AIOS in upcoming year, sir. And you have given great message to all of us about different eye care and how can we protect and what are the incidents in the female. So because the time is not now allowing us, eyes, they don't just see, they feel, they reflect. They are the mirrors of our emotions and truly the most precious gift of life.
Correct.
So thank you for being such a great mentor, and you have given us a very, very precious time and the tips of the day. Thank you, sir.
Thank you,
Thank you.
Dr. Kanchan, and like to thank Dr. Sunita also, entire Foxy members. Hope that we'll have a future interaction.
Sure, sir.
Maybe we can have a team of people sitting together and discussing for future also.
Sure, sir.
Yeah,
Thank you so
namaskar.
much. I'm grateful.